We good?
We're good. We're rolling.
We're
We're
rolling.
live.
All right, everybody. Welcome to our webinar. I'm Stuart Anderson, and we'll introduce everybody here in just a minute, but I wanted to say hi. Hi, Steve. How are you?
Hey, we're good. Good day.
Not our regular scheduled broadcast here. We're doing something different. This is a live webinar, also recorded. Super grateful for everybody that's joining us live. And if you're watching this recorded, is it just as good? I don't know. Is it just as good?
Better live. It's always
Better
better live
live.
because you can ask questions. So as we go along, when you have questions in your control panel, go ahead and type in your question and we will address your questions either as we go along or at the end of the formal presentation, because we're going to cover a lot of ground here, a lot of very exciting ground. I've been very much looking forward to this webinar today. I've been actually rolling out some of the information we're going to talk about today, Stuart, informally in different settings.
Nice.
Awesome reaction. So today's going to be a lot of fun.
Yeah, we had a lot of interest in people who aren't going to be able to join us live, and that's okay. We'll have this recorded and on the Crown Council website. I'm just noticing I didn't make it to the form at the bottom, so looks like I'm done. My name's not on the slide.
Oh yeah, sorry.
Everybody knows you, Stuart. You don't need an
Okay,
introduction.
thanks.
For the host.
Okay, so normally what we're doing at this tower is we're running a live Crown Council broadcast to all of our Crown Council members and team members to connect our community with topics and people and stories. And like Steve said, this is an incredible story that we are going to share with you probably multiple times. And there's a lot of interest. I was just telling the team here before we started that there is so much interest on our social media platforms for people signing up, wanting answers to these questions that we're going to be talking about today, and interested in sharing the recording with everybody. So that will be available along with a CE link. So after we finish, we'll mail out a 1-hour CE link form that you can take care of, as well as a link to watch the recorded webinar with your team. And I'm sure, Steve, any other announcements we want to make generally to everybody about upcomings or news?
Yeah, just a couple of things. Smiles for Life campaign is just motoring ahead. Awesome work on everybody's part to raise money. So thank you for that. Keep the good work going. I'm actually in Chicago today on my way back to Dallas. We're going to have our TOPS Leadership Academy that starts tomorrow morning. I'll be in Boston next week. We'll be doing Total Immersion, our TOPS Total Immersion course in Boston next week. A lot going on, and of course, annual events. Stu, you're coming down to Texas. We're doing a little annual event planning here shortly. 30th annual event coming up in Frisco, Texas, just outside of Dallas. It is going to be spectacular. So registration for that, ccannualevent.com, or you go to the Crown Council website to sign up, and you cannot sign up too early. It's like packed already. So
it is packed. It'll sell out too, for sure.
Yep.
Okay, Steve, do you want to introduce
All
everybody?
right.
Yeah, let's do
it. I will. So,
okay.
Welcome to our webinar. This is going to be a fast-paced, very quickly moving, information-packed next few minutes. I want to introduce, of course, Steve Anderson here. I'm the founder of Total Patient Service and Crown Council. And with us today is Sharice McCrae, registered dental hygienist and TOPS practice advisor. Hello, Sharice.
Hello. Good afternoon.
Tanya Bailey, TOPS practice advisor. Hello, Tanya.
Hello. It's so great to be with everybody.
And Colby Healy from Spectrum Solutions, who represents Simply Perio, which we'll be talking about today, and the role that salivary diagnostics plays in the diagnosis and treatment of periodontal disease. So Colby, thanks for joining us. We're looking forward to all of your genius here today. So my role is I'm going to be moving everyone along here because we've got a lot of ground to cover, and a lot of things will be useful. There will be some resources, so you might grab your phones, because I'll have a couple of QR codes that will show. Again, if you have questions as we move along, you're welcome to type those in the question box in your control panel. That's where we will address those. And this, depending on where you are in your hygiene journey, there will be, those of you that have attended our TOPS No More Hygiene course, this is going to be a great update. Recent things that we've developed and found. Those of you that have not been with us for TOPS No More Hygiene, this will be a great introduction to, and you'll be jumping in the river where we are right now in terms of the diagnosis, the treatment, and yes, the cure for periodontal disease. That's why I named this webinar the Perio Cure, because we know it's possible to cure it. It's in the past, it's kind of been, you know, once a 4910, always a 4910. Once you got it, you always have it. And we, of course, know differently now. So with that, just for context, so that everybody's on the same page, we have two organizations that are sister organizations, the Crown Council, which is an affiliation of top level dental practices all over the US and Canada that subscribe to a common practice management philosophy committed to creating a culture of success in their practice, clinically, as well as patient service, as well as teamwork, as well as Total Patient Service, which is our education coaching group that works with dental teams every day to implement the highest level of patient service and case acceptance skills in dentistry. Combined, our mission is to make dentistry the #1 patient service segment in healthcare, to make patients have such an amazing experience that everywhere else they go in healthcare pales in comparison to what happens in their dental practice, and that they say to all the other healthcare practitioners, I wish you all could pull it together and treat me the way they treat me at my dentist's office. And so having the right and proper protocols in place, like we'll talk about today, is part of that whole service equation. So with that, let's start with what we know and what we're learning, Charisse, about the true nature of periodontal disease. And I pulled some of the most recent research. Some of this is not recent, but is a big part of what we know. And that first part is what everyone knows, or at least is very common knowledge, because this has been around for quite some time from the Centers for Disease Control, about the prevalence of periodontal disease. So Charisse, how widespread is this?
Yeah, Steve, it is considered to be the #1 most prevalent disease in the world, right? And so 47% is shown here of adults age 35 and up have some form of periodontal disease. And if we look at the aging population, those that are above 65 years of age, it's even higher. It's approaching 80% of that population. So
here's a fun fact, Charisse. I think most everybody is aware of this. Is there will be more people in the United States turning 65 this year than have ever turned 65 in 1 year in the history of the United States.
Wow.
So we have had the baby boomers are going through that stage of life. Next year will be even more. So on average, there's 11,000 people a day turning 65 this year in the US. Next year, it'll be upwards of 12,000 a day on average turning 65. So it's the peak of the baby boom generation is going through that area. So when you just look at the average based on what the CDC has told us, this is a pretty widespread problem. So if you look at half the adult population over age 30 and 80% of the population over age 65, we're dealing with a huge issue here. So when I look at a practice, when our TOPS team looks at a practice and we look at the proportion of patients that come in and get an 1110, a healthy mouth cleaning, compared to how many are being treated or have been treated for periodontal disease, my first question for everybody listening is, do your treatment numbers match, or do they reflect the prevalence of the disease in America? So when I see low treatment percentages as a percentage of a patient base, it does cause some pause. I ask myself, is your patient base some kind of an anomaly, that somehow they're not part of this overall pattern that we see across the country? It's a big problem, and dentistry is uniquely equipped and in the position to diagnose it, treat it, and to cure it. So this piece, Charisse, I think is one of the most, I think, important pieces that we will talk about today. And I split this up into 3 paragraphs, short paragraphs. Let's talk about the first one, because this is historically, and again, this is all of these sources that I have cited are from the medical dental literature. They've all been peer reviewed. So this isn't just Steve making up stuff. This is coming from peer reviewed research that is now out there. You can look at all of these sources. But I just pulled these out because I think this is one of the things that's so critically important. This first piece, that historically dentistry has looked at periodontal disease as basically bacterial plaque, microbial byproducts, and host immune response, meaning dentistry has looked at periodontal disease as a calculus problem, the physical buildup of calculus. We know now that most, if not all, forms of periodontitis really should be viewed as infectious diseases. It's not just debris, but it is an infectious disease that is in progress, taking place. So Charisse, if you're going to the physician and you had an infectious disease, I don't think they would treat it by scrubbing it away. I think they would look at it a little bit differently. So bottom line here is that bacteria is at the, is really at the root of periodontal disease. It is a bacteria problem, not just a calculus. The calculus is just a residual part of the problem, but the bacteria is what's causing it. And so what's fascinating to me about this is that the tremendous amount of research in all forms of medicine that is now focused on bacteria in the mouth, bacteria in the gut. They're now saying that they're now looking at the source, the cause of Parkinson's disease. They now believe is bacterial in nature. We'll talk about Alzheimer's here in just a minute, but we're talking about a bacterial problem. And so in hygiene, the way we look at this needs to be bacterial based, not just calculus based. It's not just about SRPs. It's about what do we do with the bacteria. All right, so this one, Charisse is a hygienist. I thought this one to me is huge, and it has to do with the prevalence of periodontal disease under the same roof. So this is from research that was done just 3-4 years ago. Basically, the conclusion is that the likelihood of intravenous P. gingivalis, which is one, Porphyromonas gingivalis, which is one of the most that causes periodontal disease, that once a member of the family harbors it, that the chances of transmission to other family members in the same household can be as high as 63.5%. So, Charisse, is a hygienist, what does that mean? If you're sitting down with a patient and they have periodontal disease, what then becomes a natural part of the conversation?
Yeah. What does the spouse look like? What do the children look like? What does everybody in the house look like, right? You not only want to take a look at the patient that's in your chair and really make sure that we're diagnosing and doing all what we can to help their situation, but also making sure that we're bringing the family into it as well. So the entire family.
So the chances are pretty high. In fact, I think it wouldn't be too far-reaching to say that you cannot today, knowing what we know, knowing this, that you cannot adequately treat periodontal disease in a person without taking into consideration everybody else that's under the same roof. And I think hygienists everywhere would agree, have had the experience of treating a patient for periodontal disease and it just doesn't get better. It just keeps coming back and back and back. Well, the reason is there's a bacteria donor at home who keeps reinfecting everybody. It is a transmittable disease. So this becomes a huge part of the entire equation, and at the same time a practice builder to have a conversation with your patients who you're treating for periodontal disease about the other members of their family. So initiating that conversation is a really important part of the entire equation. Let's talk about Alzheimer's for just a moment, and I'm going to cite two recent pieces of research that have to do with periodontal disease and Alzheimer's disease. Sharice, would you like to comment on this first one?
Yeah, so this really, they were finding that individuals who had periodontitis more likely to develop Alzheimer's disease because the bacteria was found in the brain tissue, right? They did this massive study. They used this data from, I think it was about 6,000 patients that they were able to track this information from, and they really were able to make this link and make this association between, especially the PG, the P. gingivalis, with the Alzheimer's disease.
So here, I think this is another really interesting in terms of patient communication is that, for example, if you have a patient in your chair, let's say in their 30s, and they have periodontal disease, you do salivary diagnostics, they've got above threshold amounts of PG, their risk factor, they're now in a whole different risk category for developing Alzheimer's decades down the road than if they don't have it. So this is not necessarily something that develops overnight, but there's now this connection where we're talking about some pretty serious overall long-term health problems. And as I circulate in the business world, I'm always amazed at how many people I talk to about this, just business contexts that are not in dentistry. When I talk to them about this, their response to me is, why hasn't my hygienist, why hasn't my dentist told me this? This is the first time anybody's ever telling me about this. So we've got an opportunity to communicate this, the severity of it and the importance of it. And then this one, which is our last little piece of science for today, is one of the most recent studies where they have found that P. gingivalis, so Porphyromonas gingivalis, is capable of entering the brain, and that it's an accelerant, they have found, to neuropathologies, in other words, to Alzheimer's disease. And they're now clearly stating that that Porphyromonas gingivalis is capable of initiating Alzheimer's disease. So in the past, we've always said, hey, they're correlated, there might be some kind of connection, but now the science is now saying that it can be causal. It may not be the only thing that causes Alzheimer's, but they're now saying PG is a cause, can be a cause of Alzheimer's disease. So when you look at that in terms of what the science continues to reveal, this whole issue becomes even that much more important to talk to about your patients and to get your protocols dialed in. It's not just a cleaning anymore. This is now one of the most important health maintenance activities in which anybody can engage. And dentistry, it's dentistry's responsibility to diagnose it, to adequately treat it, and to cure it, to get the bacteria in homeostasis so everything is balanced, so that it doesn't create these whole health problems. So that's just a little bit of just a sliver of some of the most recent research of what we know now about the severity of it and how important it is for us as an industry to address it. So with that, Sharice, maybe you can just walk us through real quick. These are the bad guys. So we've stated periodontal disease is a bacterial disease. There are over 700 different types of bacteria in the typical person's mouth, and there are only a few that are causal to periodontal disease. It's still amazing to me that we're able to identify exactly which bacteria are causing this. So can you walk us through this just as a quick update for hygienists, dentists in general, of what all this means?
Yeah. So as you have already mentioned, there's over 700 different types of bacteria in anyone's mouth. And these 11 are the ones that are considered periopathogenic. So these have the ability to cause periodontal disease. So they've categorized them according to their risk associated with being able to cause that. So the high risk pathogens, the AA, the PG, the TF, and the TD. There's moderate risk pathogens as well, EN, FN, PI, CR, and PM. And then we've also got the low risk, the EC and the CS. Now there's two in this group that can actually cause even the moderate and the low risk pathogens to becoming more pathogenic. And that's the AA and PG. So if we've got any types of AA and PG in the mouth, we really have to take a very close look at what's in there and how can we treat it.
Considered to be the symphony conductors, they're leading the rest of the crew. I think the key of this is, if the root of periodontal disease, if it is a bacterial disease, you can't adequately treat the disease without having a handle on the bacteria in a patient's mouth. And even if they're asymptomatic, so that they may not be showing, probing depths or bleeding, they can still have above threshold amounts of some of these bacteria that could be impacting their whole health. So it's not just about probing depths, it's not just about bleeding, it's about the bacteria and managing the bacterial load in a patient's mouth. So I equate this, having understanding of this, and anybody that's spent any time with me at all knows that I work with a nutritionist. I've worked with a nutritionist for the last 30 years. We do my blood work every 3 to 4 months. We're constantly looking at the root of everything that's going on. And I now equate this oral salivary diagnostics and understanding bacterial load, and if everything is in balance, I equate that to a good blood test. Is you don't really know what's going on. You can't just rely on probing depths and bleeding as the only indication of a patient's overall health. So this becomes an essential part of the whole equation. If we're going to adequately diagnose and treat a bacterial infection, a bacterial disease, you got to have diagnostics to understand exactly what the bacterial load is, and if everything's in what we call homeostasis, everything's in balance, so that the good bacteria are balancing out the bad bacteria and we're keeping it all under control. So with that as the backdrop, let me welcome again Colby Healy. Colby is with Spectrum Solutions. And the first part of what we're going to talk about today is the right diagnostics. In addition to probing and bleeding points, which everybody has been plugged into for decades in hygiene, we're going to talk about what we know now about salivary diagnostics, how this has progressed over the years, and some of the most current findings. We'll also talk about having the right protocol in place so that you can treat and cure the disease, as well as we'll talk about the right verbal skills. So in terms of diagnostics, let me just give you a quick background. So Spectrum Solutions, Colby represents and works with Spectrum Solutions. One of their claims to fame is that they developed and did all of the DNA testing for Ancestry.com. Hundreds of thousands, if not millions of people that have gone through that process to find their ancestry. Spectrum Solutions has done all of that DNA testing, send out tens and hundreds of thousands of DNA testing kits all over the world to help people understand so this is a company that's very, very well versed in everything salivary diagnostics, because that's how they find their DNA. DNA is with salivary diagnostics. So Colby's going to walk us through. Colby, for starters, maybe you can share with us from your view what role salivary diagnostics plays in diagnosing and treating periodontal disease.
Oh, yeah, it's a great question. Thanks for inviting me on. But overall, I think I would say what role it plays, I would say it's going to be the keystone of testing. Our testing has to be the keystone of why we do it. And the reason I would say that's the case, it's like you talked about earlier, you can see all these pathogens we talked about, but until we really understand the root of the problem, we can't solve the problem. We can throw things at it that we assume would fix it. We could do a root planing and scaling and ultrasonic, but we don't know if it's working until you test. Once you start testing, you'll get that understanding of where my levels are, where they need to be, and where are they going, because you'll do a retest. It's not just test and you're done. You'll test and then retest again, depending on the severity of your levels. So I would say that's going to be the solve for it and why. Let me kind of speak to it a little bit. I'll kind of give you a little bit more background on Spectrum and what we do and what we've done. Like Steve said, we did all of Ancestry DNA's kitting, and then even during COVID, we did salivary diagnostics. So, I mean, as a company, we've done over 30 million tests out to the public. And so for us, we thought to ourselves, what can we do differently? We worked with our chief science officer as well as our lab. We acquired a lab, Allometrics, about a year ago, and between the two of them, they've developed a Perio test. And the reason we did this is because our chief science officer has 20 years of immunology studies and actual practice, and sees the value of identifying the bacteria in our mouth and how to treat it. So I think you look at what we do, the reason what we do, and why testing is so important. Testing delivers that real evidence that we talk about. It tells you the levels you have. It tells you what you can do to cure it and how to fix it. But I think the one thing that was interesting, we did a study about 3 years ago, Steve, with Dr. Wong from UCLA, and he gave me a statistic that I'll never forget. With that, he told us that every patient in their mouth they swallow about 1.5 liters of saliva every day.
That's a lot.
He was
That's a
talking
lot.
I seriously started trying to track. I'm like, 1.5 liters, come on, I know how big that is. And then you realize that's true. Well, what scares you about that is all that bacteria in your mouth is not only staying in your mouth, it's going to your whole body. It's systemic. And so with that, you have to understand the full learning of it and why we do it.
So why don't you share with us what you've learned? We've already talked about the prevalence of the disease. What have you learned through the testing you've done so far about bacteria periodontal disease that everybody needs to know now?
What have we learned so far? I think the reality of it is when we first started doing this testing, we kind of anticipated everybody would have 1 or 2 of the bacteria in their mouth. And we're actually seeing an average of 4 to 5 per patient. And so it was really interesting learning that. And then we also want to understand the value of it. What is it changing on the behavior of the person, but also what is it changing in their practice of their own oral hygiene? So if you want to, some of the statistics you went over earlier are very similar to what I'm going to show you here. We have 80% of adults over 35 have a gum disease. And similar to what you've talked about already with the Alzheimer's, there's other diseases that are like cancer that if you're not taking care of it, that's a leading risk of it. So it shows up there up to 50% greater risk of cancer with gum disease. And so there's a huge risk of it that we look past and we really don't pay attention to. I would say similarly to when I used to go to my doctor before testing for perio, I would take it, I'd get poked and I'd be bleeding after, and she'd be like, well, you're just bleeding because I poked you. No, you're bleeding because you have infection.
That's right.
And so now that we understand why it is and what we need to do to treat it, we are able to solve that problem with testing and then taking the results we get from testing and treating it in the doctor's offices. You can go ahead and go to the next slide.
So, yeah, why don't you tell us, just so everybody's got a view of this, what makes Simply Perio, which is the name of the testing product, what makes it different?
Great question. I think a lot of what we do, and the answer to the question before was, are all testing the same? Well, really the answer is no, because not everybody is looking for all the pathogens. You got to look for the right pathogens. You got to look for the right markers on it. And then the easiest thing is it's got to be quantitative for a person, for the dentist. We give quantitative results. So everything you get measured back from us is going to give you the quantitative answers. You're going to get the levels where you're at, and it'll tell you exactly where you're at. I'd also say the ease of use. I brought a kit just to kind of show an example. This is what the kits look like. They'll come to you in a case. The nice thing is for you is we understand your time is sensitive at a dentist's office. So we make it with a pre-packed shipping label on it. Inside the kit, there's going to be 2 things. There's a salivary diagnostic test kit you'll take out, and then there's also going to be a saline tube. And in that saline tube, we make it so you don't have to spit even. You just rinse. You'll dump the saline, rinse for 20 seconds, agitate the gums, and then spit it into the device. And then the device actually has a cap on top where the preservation buffer actually distills down into the saliva sample. They'll shake it. And the nice part about that, Steve, and I think what makes this different, is that actually takes that snapshot of their mouth at that time and stabilizes it with our preservation buffer. So there's no more growth from the time of collection to the time it's processed at the lab. So you don't have to overnight ship it. You don't have to cold chain store it. You literally take the sample, you put it back in the same box it came in, and put it out for USPS to take it. That'll go straight back to our lab and then just processed within 24 to 48 hours of receipt at the lab.
So I'm gonna, if it's all right, I'm gonna put a example of a test report on the screen, and maybe you can just walk us through this. I mean, there's different tests that are out there. Maybe just walk us through this real quick.
Yeah, we call them in different, we grouped them a little bit differently. We grouped them in our own way of doing purple complex. So you'll see as you zoom in, I can zoom in for me at least, so I can read it for you. But we have the purple, red, and orange, and then green, and then we have the caries and then fungal for yeast. But then we also at the very bottom will have the 4 viral targets. So you're gonna receive a total of 16 targets. And of those, you're gonna see on the top 12, you'll see the actual quantitative results. You're gonna see where I'm at. If it's in the red, we have a problem. If it's in the yellow, we still should look at it. And when it's in the green, that's where you wanna be on all of these. And you'll notice on the caries, the SS will actually be on the other side because you want the SS to be higher, but you don't want the other one, the mutans to be lower. And so what's interesting is you'll see as that's the only one's flipped. But what's interesting, this sample you're taking right here is of a patient we took, did a sample of them. They had 3 in the red, and then we took them to a dentist and we did some treatment, and they were prescribed a mouth rinse. They took the mouth rinse from the dentist. They did a special toothpaste as well. And then if you flip to the next screen, you'll see the results of that. This patient went from red to yellow on only 3, and then everything else is in the green. So they're in the watch zone. I would say that they're still going to be someone you want to retest because it's not like you treat it and you're gone. It's done forever. It's something you want to treat, test it again, and then you would probably test quarterly or if not biannually.
So one of the things that's interesting about this, so you also test for caries risk, which that's different. I love that. So there's been a lot of things that have been added to this. So like I said, when we began, when I, as a patient, when I truly understood this, it was a game changer for me because it's not just what's going on periodontally, but this has overall impact for total health and keeping these bacterial loads in homeostasis, so they're balanced and they're not out of control, is I think one of the most important things for overall total health, based on what we're learning now of the bacterial nature of a lot of things that have been a mystery, including neurological diseases. So with that, Colby, tell us a little bit about if somebody's not doing oral salivary diagnostics or they wanted to give simply perio, wanted to incorporate in that practice, how does that work?
Super simple. You'll see down at the very bottom, there's the QR code. You'll scan that QR code. That's going to relate this to TOPS. So we'll give you the deal for TOPS that we've provided for them and Crown Council. We are willing to offer, so right now you'll get a case of 24 kits. Of those 24 kits, we're offering to give you the first 5 for free. So we want you to use it in your office. We want you to utilize it so that you can test yourself, but then also see the ease of use for your hygienist. I want them to understand and buy in so that they understand this is an easy test. It's not laborsome. It's not cumbersome to take. It really does this. And then also utilize that to see how it'll change your practice. They'll get the 24 test kits. They'll get a welcome packet. They'll get a chairside guide from us. They'll also get patient cards for the dentist office, and then we'll also have posters. So if they want posters from each bay, we can give them posters. So really all of that will come in your first shipment. And then as you need more materials, we can order those and get those to you at any time.
Love it. Thank you, Colby. And thanks for
one thing I wanted to be clear, Steve, can I just mention one thing? Just on the payment part of it, I want to just explain that real quick. We send these to you at no cost. You're only charged once it's processed at the lab. So it's not something you have to pay up front. You get to take these kits, utilize them, and then you'll get it back, and then we'll charge you once it's been processed.
Excellent. And fee for a test is
$90.
There you go. And then it's up to the office to decide what they want to charge as far as the patient's concerned.
That's correct. We have offices that do it right now that give it to them at just cost because of the added benefit for the op practice. Then we have offices that charge up to $150.
Got it. Very good. thank you for sharing the latest in testing. Appreciate it.
I'm
And
excited. Thank you.
love the additions that have been made here that gives the patient even more information on their overall health. So thank you. All right, so with that, when you got the right diagnostics in place, and that's testing is just one of the areas of diagnostics. Obviously, you continue to do probing depths, bleeding points, all those things that we know are part of that whole diagnostic process, and testing becomes a big part of that. Treatment protocol. So Charisse, let's talk about what we know now. If the basis of periodontal disease, it's a bacterial disease, how do you treat a bacterial infection? And so, you know, the first requirements that we have in terms of mapping this out is you got to have the right protocol. And Charisse, maybe you can talk real quick about having a perio protocol in writing in the practice. This is one of the first things I ask a practice that we work with at Total Patient Services. Do you have a perio protocol in writing? So what does that include?
Yeah, having your standard of care in writing in the practice so that all of your team members are all on the same page and very much calibrated to following that protocol. Absolutely. So following the AA guidelines in staging and grading and knowing how to stage and grade. Very important. Yeah.
So a big part of this is, and again, if there's going to be consistency across the board in terms of how a patient is treated, if I go into a practice as a patient, it shouldn't matter the hygienist that I see, no matter who I see. I get the same treatment across the board because this protocol is in place in writing that includes, you know, what we see and what it means. So when we see this, this is what it means, and then this is how we treat it. So that's, you know, again, that's an involved process to make sure you have your diagnosis and treatment protocol in writing so that everybody on the team, every hygienist is looking at it through a standardized lens so that there's consistency in how it's diagnosed and treatment planned and treated in the office. So that's requirement number one. You got to have your protocol in writing. In terms of treatment, what's the most effective treatment we know? So Charisse, you've got a great word picture for this of how we used to treat periodontal disease in the past and what we know now of how the most effective way to treat it.
Yeah, so this is traditionally what we've always been accustomed to, right? Our scaling and root plating, or getting in there and tearing down the house that is using our ultrasonics, right? And so we really want to disrupt what the bacteria has already accumulated in there to really disrupt the further damage to the tissues. So getting in there with the ultrasonics, what we say is tear down that house.
Right, so that's, you know, traditional scaling and root planing and getting rid of the debris and all that, and that's traditionally where dentistry has stopped. We now know that's not sufficient. If you're dealing with bacteria can hang around even if the residual stuff, even if the calculus is no longer there, the bacteria can still survive. So that's the other piece of this that's critically important, which is?
Yeah, so what we say is send in the troops then, right? Get the troops all spread out in there, and that's using the irrigation, really choosing the bactericidal medicament to get in there to eradicate the bacteria that's within that sulcus.
So Charisse, maybe you could just differentiate for everybody the difference between bacteriostatic versus bactericidal.
Yeah, so
there's a difference, and the big difference between the two.
Yeah, so bactericidal means it's going to go in there, it's going to kill the bacteria, it's going to kill the spores, it's going to kill it all, right? Bacteriostatic means it's going to control the growth of it. So it can kill the bacteria, but oftentimes it doesn't kill the spores. So we really want to make sure that we're killing the bacteria and the spores through the irrigation. Yeah.
So we want bactericidal.
Yes.
If it's going to actually address it.
Yeah.
Got it. And then third piece of this, let's talk about what is the appropriate use of antibiotics.
Yeah, so the benefit of what Colby and Simply Perio is doing is really ensuring that we're going to apply systemic antibiotic therapy for those that really need it. Could we go in there and give antibiotics to everybody as just part of our standard protocol? We could, but that's not always the smartest thing to do. We know what overuse of antibiotics can do, and so we really want to make sure that we're testing it, knowing what we're going after, and applying the systemic antibiotics when necessary.
So those 3 ingredients, yes. Scaling and root planing, yes. We're going to irrigate so that that specific bacteria is addressed, and then in some cases systemic antibiotics to deal with the bacteria as well. So those 3 things appropriately for every patient is at least where the standard of care has risen today, and the only way you can responsibly administer all 3 of those levels is you got to know what you're dealing with. You got to know the type of bacteria that you're dealing with and where things are. So with those 3 building blocks, the challenge here is to go back and really look at your protocol. 1, is it in writing? And then number 2, do you include what you see and what it means? And then number 3, does your protocol include all 3 of these treatment modalities depending on what level of the disease you're dealing with? So that's the construct of where we are today in terms of what we consider to be standard of care for diagnosing, treating, and ultimately curing periodontal disease. So those are the 3 things. And again, the recommendation: does your perio protocol, 1, do you have one? And number 2, does it include all 3 of those, that 3-step approach? Thank you, Cerise.
My pleasure.
Let's talk about verbal skills, because obviously we need patient cooperation if we're going to diagnose and treat this adequately and introducing things on the right basis to the patient. So Tanya Bailey, who is a practice advisor, total patient service, Tanya's going to help us with verbal skills and also with what happens to the practice when the right protocol is in place. So Tanya, let's talk first about what patient expectations are today. They've shifted. Patients are becoming a lot more whole health conscious. And what we know today about their expectations is based on research that was done at the University of Massachusetts at Boston, is that 85% of patients want you to check for periodontal disease. They may not know the terminology, but based on the research, they want somebody to check. They want to know what their level of health is. So we got the patients on our side on this. And here's the interesting part. And Tanya, from a patient service standpoint, maybe you could address these findings, because I think they speak volumes about how we need this game innovation.
Thanks, Steve. So, you said something earlier that just stuck out to me as we look at these statistics. You said, as you go around the country and you interact with other people outside of dentistry, they want to know what's going on. And I don't think it's any surprise that our public is saying, help me know how to take care of my health. So 78% of the total population views their oral health as part of their overall health. Now, I think in dentistry, sometimes we think we're the only ones that think that, but this study proves that our population says the same thing. And yet, only 58% of offices talk about health issues. And I always wonder what's getting in the way there. We are healthcare providers, so why are we not talking about this? And I think you learn in the first 20 minutes of total immersion that approval addiction is live and well. Yeah. So are we making that connection? Only 51% put those all together and talk about that correlation between oral health and overall health and how they actually go together. So our patients want to know, and I don't think it's just important that we talk about it. I believe we have a responsibility to our patients to tell them the truth, let them know what's going on.
So with that, let's talk about some overall verbal skills. What we know is that patients who view their dental health as poor are also likely to rate their overall health as poor. So they understand the connection. So here's a couple of mistakes that we make that continue that create a disconnect for patients. Number one is, by law in every state, you have to update the patient's medical history at every visit. So even if they were in your office yesterday, you have to update their medical history today. Here's the biggest mistake we make in that area, which is the common question is, Tanya, any changes in your medical history?
Nope, no changes.
There's never any changes until we get to the end of the appointment and the patient starts talking about their recent open heart surgery.
Yeah.
And it never fails. Well, we created the problem because of the question. It's the wrong question. Any is a question of lack. Any is the word of zero. I don't have any friends. I don't have any money. I don't have any time. I don't have any patience. Any means no, no, no. There isn't any.
Right.
So we need to be asking a different question, because using the word any evokes a no response. So the correct question should be, what changes? What changes have there been in your medical condition, in your health since I saw you last? What specialists are you seeing? What medications have you started taking? What medications have you stopped taking? What changes have there been? Because 80% of patients will have had some type of change in their medical condition, which then gives us the open door to talk about whole health issues. Well, I started taking blood pressure medication. Well, there's an open door. Has anybody ever talked to you about the correlation between high blood pressure and the health of your mouth? Et cetera, et cetera. So that's one we highly recommend. Start asking the right questions to your patients. What changes have there been? Not any changes. And then, has anybody ever shared with you? Open up the conversation by seeing how knowledgeable they are and if that conversation has ever happened.
Can I add
Here's
one?
the second one. Yes, go for it.
So one of the things that I'm seeing more and more and more in my best practices that are very focused on this overall health idea is in addition to what we have written on that health history is what conversation did you have with your physician about your last A1C? Because A1C is now the gold standard. It's no longer the 24-hour fasting blood glucose. See if I can spit that one out.
Yeah, there you go.
It's amazing to me, as more and more people are diagnosed with diabetes, what percentage of the population can spout out their A1C? I can, but I'm not going to tell you what it is. So
right, because it's the longer term measure.
Yes, yeah. So it's just another topic of bringing in that most recent blood work. At your last physical, do you remember your blood work findings? Can you share a copy of that? What was your CRP? What was your platelet level? What was your A1C?
All right, with new patients, the traditional way to address this, if there's signs and symptoms of an infection, to tell them you have an infection. And of course, the response is usually always the same. Well, it doesn't hurt. So it's just a disconnect because of the way it's presented. So the correct question, instead of telling them they have an infection, is, how long have you had this infection? So that's the question that gets asked. Just to new patients, only ask that to new patients. But how long have you had this infection? Because the response will always be, what infection? And then you can have an open dialogue about what you're seeing, show them and have a conversation about what its impact is on their total health, and then what treatment is available. So how long have you had this infection? Tanya, in the few minutes we have remaining, let's talk about results. You've got a tool here for every practice that will help measure the overall health of the hygiene department and what's going on, as well as a case study. So share with us how we can tell if we're really doing a good job in hygiene of diagnosing, treating, and curing periodontal disease.
Yeah, so this is why I live for what we're about to talk about next. I get so excited because what we know is that when you do the right thing for the right reasons, the numbers show it. The numbers tell the story. The financial piece comes along. And so when you are diagnosing, when you are treating, the natural consequence of that is you're also going to have a healthy hygiene department or an oral health department in your practice. And so we have what we call a snapshot health report for hygiene, where we can look, and I can tell you your Perio standard of care by simply looking at this worksheet. I don't have to meet you. I don't have to have a conversation with you. Your standard of care is revealed in the numbers. So we've created this health report really off of something that Steve shared with us a long time ago. He mentioned working with his nutritionist of over 30 years, and that really Steve Anderson was not interested in average health, he wanted optimal health. And so as we took that principle and applied it to practices, we don't work with average practices. The Crown Council Network is optimal practices. So we set up our benchmarks based on what we see all over the country for optimal. So first of all, as a total percentage of total practice production, are you at 35% or more when you look at hygiene revenue? And as a quick reminder, hygiene revenue is hygiene revenue. It doesn't include doctor's exams. Doctor's exams belong in the 65% of practice production. Or more. Some of our very best practices find that they move up to 50% or higher in that total revenue. When we look at production per visit, statistically, we want to see your production per visit at least $225 a visit. Now, I know many of you are thinking, but wait a minute, Tanya, we're PPO. I know. And so this is based on that. If you're fee for service, this number goes even higher. Much higher. So this is your baseline for optimal. And again, same thing here, production per hour. Your production per hour as a general rule of thumb should be to be profitable. So don't be the Costco chicken. So for those of you that know what that have ever shopped in Costco, at the very back of the store, they put those rotisserie chickens and they sell them at a loss. It's a loss leader. Why? Because they know you're going to walk through the store to get a chicken and buy another $500 worth of groceries. So in hygiene is not a loss leader. Hygiene is profitable at or above $175 an hour. If you're wondering now, why is the visit value higher than the hour value? Well, not all appointments are created equal from the time factor, and we have to allow for those occasional changes in the schedule. Our next numbers, now we're really going to get into some fun statistics here. So if you are really on your game and you are diagnosing perio according to what Cherie said, those AAP staging and gradings, which are very much focused on bleeding, inflammation, and radiographic bone loss, at a minimum, you're going to see 15%, click 15% new perio diagnosis in your practice when you look at any rolling 90-day average. And then our next statistic, oh, and let me just share with you that on average, we see it's about 2%. 2%. So there's some work to be done there. And then here's what gets really exciting. So I just looked at this number this week in a practice I was at. And so what's astounding to me is our perio case acceptance optimal number that we see in our practices is 66%. And doctors, I can share with you, if you had 66% case acceptance on your restorative side, you would be dancing on the table. So 66% perio case acceptance is our optimal case acceptance number. And as we work with our practices on the highest levels of implementation, it's not uncommon to see that go as high as 80 to 90%. Why? Because 78% of the population wants you to talk about whole health issues. So our perio visit, total really as a percentage of like the numbers of patients is what this really is. We want to see the numbers of visits in your total hygiene department be perio related by coding. At least 35% of those visits would have a 4 code. So a 4910, a 43, 41, 42, 43, 46. And I say at least because, again, this is where optimal starts, but it can go higher up to 50%. And then you may be wondering, well, what does fluoride have to do with perio? Well, a great prevention program and a great benchmark on how well we can communicate with our patients is sharing with them that fluoride benefits, that is, of course, traditionally not a covered service with dental insurance. And so our optimal number on fluoride is 80%, and that's 80% of the visits. So if you look at your total numbers of propies and maintenances, and then you divide that by your numbers of fluoride treatments, what percentage of those had a fluoride treatment? So those numbers, oh, we've got more, sorry. And lastly, of course, keeping the schedule full. We want 90% or more of our patients reappointing to come back. Don't wait to schedule them in the future. If your future number is not, if we're not rebooking at 90%, then our pre-appointment rate in hygiene is going to steadily decline. And that 90% in 6 months becomes 80%, becomes 70%, and we keep on declining down. So that's our practice health report that tells me where a practice, would tell us where a practice is at. And I thought it would be fun to put together a really fascinating case study. So, you know, at Total Patient Service, we track everything. And so I took a practice, and I just want to give some clarity. This was no basement practice here. You can see by these statistics, they already had 23% of their patient visits through hygiene were perio, and they were presenting perio. They were better than that average of 2%. They were at 7%. And their hourly production was okay. And you might look at that and say, that's good enough. But we don't do good enough at TOPS. This practice came through our TOPS No More Hygiene program and hit the ground running. So we have about 18 months of data now to support where they are today, and they're continually increasing. Their perio visit percentage is now up to 34%. So that's a 48% increase from where they were to where they are at. And this is data as of earlier this week. But watch this next one. Their perio percentage was at 7%, and now they're actually right above that optimal number at 16% for a 129% increase in diagnosis. Now, I said do the right thing for the right reason, and the money takes care of itself. So by increasing that diagnosis, look what happened to their hourly production.
That's crazy.
It more than doubled. Now, I'll also tell you, in amongst all of that, we worked on scheduling efficiency and a few other things, but the number one reason that that number increased is because they started being, they started diagnosing according to the staging and grading guidelines, and then they started treating comprehensively. So if you just kind of want a code breakdown, this is just another thing that I thought was really interesting. I told you we worked on schedule efficiency. So their propy numbers, so just numbers of procedures in a time frame. I used a year amount, was 1,323, and they actually went up. So they actually did more because they saw more patients more effectively. But wait, look what else happened. They went from 1,323 profies and only 225 maintenances to how many maintenances, Steve? 387. So you can see that their volume increased, and this happens to be a single doctor practice. They had to add hygiene time, and it was hygiene time that didn't need any more exams because, as you can see, they increased their maintenances. Their SRP quads went from 109 to 341. And then what's really astounding is this next statistic. They were already using a gingivitis code. They had 158 of them, and look what happened. It actually went down. Now, why would that number go down? Because they admitted that approval addiction was alive and well. And so sometimes they were coding a gingivitis code when it really should have been an SRP code. So this study, this is just a quick snapshot of what happened in this practice. And in addition to those small statistics, their total practice revenue has gone up. Their hygienists, if they were on this webinar today, would be telling you how much more exciting their career is, how much more fulfilled they are. And their patients say things like, my mouth has never felt so amazing. So it is a whole team approach. They would also tell you they couldn't do it without the support of their assistants and the support of the doctor and the support of the admin team. So implementing these systems and protocols takes everybody.
Thank you, Tanya. Thank you for the really a great outline of a healthy hygiene department. You can take those and measure the health of your own. And here's a couple of resources as we wrap up. We've given you some parameters today in terms of where perio is headed, how we diagnose this, how we treat it, and our hope is that in everything we presented, there have been some things that you can add to your own treatment protocol to really up your game. So here's some resources. First, how healthy is your hygiene department? Go through that hygiene health report, take those numbers, compare yours, and see where the opportunities are. If you'd like a copy of that, if you want the worksheet, just you can email us at answers@totalpatientservice.com and just ask for the hygiene health report. In addition to that, the highest performing practices that we have in hygiene have one thing in common, and that is they've attended the TOPS No More Hygiene course that walks through the highest level of protocols that are being used in detail by the top teams in dentistry today. So you can scan that QR code, and that will take you to a landing page that will give you more information about the next TOPS No More Hygiene course that'll be in Dallas, Fort Worth, where, and I would say it's a whole team experience. The best teams we have, they get the entire team on board to really up their game in this area. It is one of the most pressing health issues overall, and dentistry is right there in the driver's seat to diagnose it, treat it appropriately, educate patients, the whole health consequences, and ultimately the goal is to cure it, to cure periodontal disease. So I want to express my appreciation to Sharice McCrae, Tanya Bailey, Colby Healy. Thank you for all of your input and wisdom today in giving all of our listeners an update on where things are today in the whole hygiene area, perio treatment, part of your practice, and what's possible today. So our challenge is up your game. There is a huge medical need here to help patients get healthy and get healthier. It can have whole health impact. In many cases, it will change the trajectory of their life. That may have sounded like an overstatement years ago, but today we know it is absolutely true, the whole health impact that periodontal disease has. So thanks for joining us today for our webinar, the Perio Cure, and we look forward to joining you on your journey to up your game and create an even more robust periodontal protocol in your practice. Thanks for being with us.
Thanks,
Steve.
Steve.
You're
Thanks,
awesome.
everybody.
Thanks, Steve.
Thank you.
Appreciate it.